They went to the doctor, but were secretly infected. Imagine going to a doctor to solve a health problem. You trust them. After all, they took the Hippocratic Oath. You believe they want to heal you. You put yourself in their hands without fear. But instead, they infect you with a dangerous disease. You are not told. No permission is asked. You are used. I can almost hear you saying, "That's impossible." Brace yourself. This really happened. Its name: the Guatemala Syphilis Experiment. Background: in the 1940s, syphilis was a very serious disease. It spreads through sexual contact and can damage the brain and heart. It can even kill. At that time, penicillin had just been discovered as a powerful new medicine. Scientists wanted to test how effective it was. The experiment was conducted by the United States Public Health Service. The lead doctor was John Charles Cutler. The experiment took place in Guatemala between 1946 and 1948. What happened? Finding subjects was not difficult. The victims were some of the most vulnerable people in society: prisoners, soldiers, patients in mental hospitals. They were not told the truth. No consent was given. Doctors deliberately infected people with syphilis. Some prisoners were sent sex workers who had the disease. In other cases, bacteria were placed directly onto people's bodies. Some were injected. Around 1,300 people were involved in the experiment. Many were not properly treated. At least 83 people are believed to have died. The most shocking part: the doctors already knew that penicillin could treat syphilis, but some participants did not receive full treatment because researchers wanted to observe how the disease progressed. They were used only to collect data. The experiment remained hidden for more than 60 years. In 2010, it was uncovered by historian Susan Reverby. Unlike the Tuskegee Syphilis Study, which became widely known, the Guatemala experiment was kept secret for decades. No one went to prison. No one was criminally prosecuted. Why Guatemala? Why didn't they do this in the United States? Because it would have been illegal. The laws in America were clear about such experiments. They would have faced serious consequences, so they chose a poorer country. They chose people with less power. They chose people who could not defend themselves. The aftermath. Here is one clear proof that the experiment was real. In 2010, the U.S. government officially apologized. President Barack Obama personally called the president of Guatemala to apologize. An official report stated that the study was clearly unethical, but for many families, an apology was not enough. The big question: this story is not just about the past. It is about trust. It is about power. It is about how far science can go without ethical limits. Today, medical research follows strict ethical rules, but those rules exist because tragedies like this happened. So here is the question: if this experiment had never been discovered, would anyone ever have taken responsibility? What do you think?